Hi everybody, welcome to Nursing Credits channel. Today I have planned to share the information regarding practical examination. So in the first year, many students will be having different queries about the pattern of practical examination. So I have planned to discuss about this process. So the subject will be Nursing Foundation. Okay, so for this practical examination, two examiners will be allotted by the university. So first is external examination. This external examiner will be allotted from other college, whereas internal examiner will be allotted from your college. Clear? So two examiners will conduct this whole practical. So the process will be done in two parts. Part A, Part B. So Part A will be in the hospital block. So the allotted hospital will be there for practical examination. And Part B is college block, that is nothing but Nursing Foundation lab. Okay, first we'll discuss about Part A. So in the Part A, first thing is allotment of patient. For each student, there will be allotment of a patient. Okay, so after allotment, you have to introduce yourself to the patient and you have to collect the basic details about patient and their chief complaints. So after that, next thing is you have to write. Okay, what you have to write? The papers will be given by the examiners, answer sheets. So there, first thing is you have to write KARDEX. So you have to draw the KARDEX form and you have to fill all the details like patient details, name, age, next nursing care plan, and also IP number, bed number, doctor name and diagnosis, and what are the medications prescribed for the patient and fluids. Okay, these are the details you have to enter in the KARDEX. So how you will write this KARDEX details? You have to take this from the patient and you have to check the case sheet of the patient to know about the medicines and fluids and about the diagnosis details. These details you will get in the case sheet. So this you have to write down. So after that, next thing is nurses notes. Nurses notes means nothing but done by yourself. So whatever the care planned by the yourself will be written in this nurses notes. So in the nurses notes, you have to write patient basic details like name, age, date, and also diagnosis and doctor's name. And next you have to write the things like what the food they have taken, next what are the medications they have given, and any fluids were running or not. You have to mention, and you have to do this vital signs. You have to check the vital signs, and you have to plan one health education and one therapy and one care depending upon the patient care. That and all first you have to write down. Next, history collection. So history collection means this is all about the patient. So first thing is you will write all the basic details about the patient, and next head to foot assessment. These and all details you have to fill in the history collection format. So after that, so by this time around 45 minutes will be given for this process. So after that, these examiners will come and meet you and they will conduct bedside viva. So bedside viva means nothing but they'll ask you questions about the patient condition. So by this, part A is finished. So the next is part B, college block. So in the college block, there are 4 sections were there. What are the 4 sections? Bed making procedure, tray setup, dosage calculations and bandages. So you will be allotted one bed making procedure. So what are the types of bed making? Like closed bed, open bed, cardiac bed, burns bed, etc. So one procedure will be allotted for you that you have to perform in the lab. Next, tray setup. So what is a tray setup? You have to arrange one procedure tray setup. For example, nail care. So if you get nail care, you have to arrange the setup. So what are the equipment needed? Like a bowl, next warm water, towel, nail cutter, kidney tray, paper bag and one Vaseline. These are the tray setup that you have to arrange and you have to show to this examiners. So they may ask you simple questions like what is the purpose of nail cutter, what is the purpose of kidney tray or paper bag, like that. They may ask you simple questions about that particular tray setup. This is the second section. And next is dosage calculations. So dosage calculation means nothing but they'll give you a problem statement. Okay. So you have to solve the question and you'll be getting some readings. So that readings, for example, for calculating a drug or any fluid, IV fluid calculation or simple dosage of drug. Okay. So according to age of the patient, weight and everything. So it will be clearly formulated the question. So that you have to calculate and you'll get one result, right? So that result you have to show them like a demo. So you'll be given calculation methods and this equipment will be also provided like measuring jars, ounce glass, droppers. So that whatever the value you got, you have to show them practically. You have to use the equipment and you have to prepare and you have to show to the examiners. That is the dosage calculation. And next is bandages. So we are having different type of bandages like spiral, reverse spiral, spica, figure eight, triangular bandages. Different are there. So each student will be allotted one type of bandage. They'll mention the body part also. For example, finger spiral, next any triangular bandage for head, like that. They may ask you one type of bandage that you have to perform before them and you have to show to them. Okay, so that is the bandages you have to do. And next thing is viva. So again the viva will be conducted by the external and internal examiners. So they may ask you any question from the syllabus. So that you have to be prepared and you have to answer them. That is the viva. So another important thing is there, that is performing a procedure. So each student will be allotted one type of procedure. So this performing a procedure, it may be conducted in the part A session or part B. So depending upon the time being and also examiners, they may plan at the patient side or in the lab setting. So if it is planned in the part A, that is hospital block, then you have to do the procedure to the allotted patient like hair care, nail care, mouth care or vital signs checking like TPR or checking the BP, etc. According to the patient need, you have to do the procedure before the examiners. Okay, otherwise they have planned in the lab. So in the lab, you'll be given one mannequin or sometimes they may give you one partner. So you have to do that procedure on that mannequin or partner. So by this performing a procedure will be finished. It may be done in the part A or part B. Clear? So I hope this is the pattern of practical examination. I hope this is clear for you. If you have any queries, please make a comment. Okay. So please like, share and subscribe my channel. Thank you.